what do you do at the Medical Society of State of New York, and what does it do? What is its role?
Okay, so there's a lot of roles that we have at the Medical Society. One of them is we advocate for physicians, but we also advocate for patients. And, let me say some of the stuff that we've done for physicians. Over the last year or so, I've seen 3 or 4 physician suicides that came across my desk. And it's a very, very bad thing. And, because of the pandemic and, doctors had to go to work every day, well, a number of other different specialties, not specialties, but people stayed home. Even now, so much hasn't recovered, and a lot of stuff is done on Zoom. But for physicians who we have a peer-to-peer, we call it P2P, for physicians that if they're having stresses, they can do that. And we also have a thing called the Committee for Physicians' Health. The Committee for Physicians' Health is something that was developed years ago, and we used to, and in our registration fee for our license, $30 of that covers it. This year they're looking to take that out of the budget, and we've made a big complaint about that. Other things that we do is prior authorizations are one of the hardest things in the world to do. You spend time on the phone, or you have to pay somebody to be on the phone to convince the insurance company that the patient that you're treating, that they have no idea who it is, needs a certain procedure or needs certain procedures. So those type of things are there. Also, I heard with the last guest you were talking about medications. Certain medications need prior authorization because the cost is high. So we do that. We have also worked on trying to make sure that hospitals don't get closed, and trying to make sure that the state knows the downstream effects of closing a hospital, because all the other hospitals are greatly stressed, and when you close one hospital, those patients are going to be going there. We're also dealing with physician shortages, and there's a move underway to give PAs more laterality and let them practice independently, which I talked to you about the last time. I'm very, very much against. I think they're very important for the team, but I think that the medical team for the patient. But I also think that in some sense of the word, if they wanted to be doctors, they could go and be doctors, and I think they need to have the guidance of a physician at all times. We've looked at things that would call the Grieving Families Act. That was vetoed twice by the governor, which I have to commend her for, because that will be a big challenge for people. Malpractice insurance will go up by about 40%.
What is it? What's the nuts and bolts of the Grieving Families Act?
Okay, so the Grieving Families Act was passed twice, overwhelmingly by the Senate and by the Assembly. And the Assembly is 150 people, and I think maybe 6 or 8 of them voted no. In the Senate, maybe 3 or 4, and there's 63 senators. What that is it actually, it started out when someone drove the wrong way on a parkway, crashed into a car and killed people, and they were limited in how much money they could recover. So, all of these bills get names of people on them and, gain support. The physicians who would come to help these people, when they're in dire straits and were also lumped into this. So it expanded the amount of time that people could do. The statute of limitations has been 2 years. It started out as 3.5, and now they've got it down to about 3. And also the scope of who could actually be involved in a lawsuit, who could, a close friend, other people that are in there, and it expands the amount of damages that can happen. In New York, by double the nearest closest state, have the highest malpractice awards anywhere in the country, and that's a factor that drives physicians out of New York.